Myasthenia gravis is the most common neuromuscular junction disorder, and you need to know it for step 1. Let's start with pathophysiology. It's an autoimmune disorder, you know that, caused by antibodies against the postsynaptic acetylcholine receptors, leading to impaired neuromuscular transmission. And how does it present? Fluctuating, fatigable muscle weakness that worsens with use. Okay? Ocular symptoms are very classic. Ptosis, diplopia, bulbar symptoms, dysphagia, dysarthria, difficult chewing. Proximal muscle weakness, think about that, difficult holding the head up or even difficult combing the hair. Respiratory muscle involvement may happen, which is part of myasthenic crisis. How can we diagnose that? We can use bedside tests like IcePack tests, improves ptosis, for example, hydrophonial, which is tensilone test. Acetylcholine receptor antibodies are highly specific, we can measure that. CT chest scan is mandatory to check for thymoma, remember that. And how do we treat acetylcholinesterase inhibitors? For example, pyridostigmine. Thymectomy if thymoma is present. Okay? We can also use immunotherapy with steroids, azathioprine for severe cases. Okay? The myasthenic crisis is a severe respiratory muscle weakness leading to respiratory failure, of course needing intubation. And the triggers for this myasthenic crisis can be like infection, surgery, pregnancy, medications like aminoglycosides, beta blockers, and also tapering immunosuppressants. Okay, so keep that in mind. How do we treat the myasthenic crisis? Intubation if needed, plasmapheresis or IVIG, IV immunoglobulin. Okay? Steroids after stabilization only. Okay? So the step 1 key takeaway for you guys, fluctuating weakness that worsens with activity, think about myasthenia gravis. Okay? Ocular plus bulbar symptoms are very common and classic. To diagnose, you can use IcePack tests, mostly in your tests, but in real life, you're gonna use acetylcholine receptor antibodies. You have to do the chest x-ray looking for thymoma, and the treatment is gonna be done with anticholinesterase inhibitors, for example, pyridostigmine. Thymectomy if the patient has a thymoma. For crisis, IVIG or plasmapheresis. And also know how to differentiate it from Lambert-Eaton syndrome, which actually improves with use and is related to lung cancer. Remember that, old cell. So save this for review and share with your friends also preparing for step 1. See you next time.